Subcostal long axis view. Place the probe at the subcostal area with the dot aiming directly to the patient's left side. Press the probe down and angle the probe up and slightly to the left. You will note the liver at the top of the screen with the 4-chamber view below. The chambers are labeled for each structure.
Starting point for the examination, views should be obtained with the patient. Transducer for assessing the abdomen is a curvilinear array probe with a frequency range of 2 to 5 MHz. Select the abdomen preset on the ultrasound device. The overall approach to scanning the liver is to begin at the rightmost superior margin and end at the leftmost inferior margin, scanning side to side. The liver can be viewed through the subcostal region as well as the lower intercostal spaces. The beam should be aimed toward the patient's right side. One major landmark seen in this transverse view of the right lobe of the liver is the inferior vena cava, or IVC. The IVC becomes intrahepatic in location before draining into the right atrium. With the probe marker pointed proximally, the knee includes the condyles of the distal femur, proximal tibia, and the head of the fibula. Anterior to these structures is the patella. The 4 tendons of the quadriceps muscles join to form the quadriceps tendon. At its inferior end, it is attached to the patellar ligament. Ask the patient to flex the knee. With the probe marker pointed to the patient's right, place the probe over the distal femur. Slide the probe distally to obtain an optimal image of the condyles of the femur. Identify the quadriceps tendon, the femoral condyle, and the articular cartilage. With the probe marker pointed proximally, place the probe over the distal end of the patella. Track the patellar ligament to the tibia. Identify the patellar ligament, the fat pad, and the tibia. The anisotropy artifact is a phenomenon that can occur when the probe is not positioned perpendicular to the tendon being imaged with ultrasound. In this suprapatellar image of the knee, the quadriceps tendon is largely hyperechoic. When the probe is rocked slightly to make the ultrasound beam not perpendicular to the tendon fibrils,